Hola, ¿cómo están, my compañeros? I'm right here to discuss why perhaps professional-minded men and women might be inclined to fudge the data about influenza and do the bait and switch on the general public, replacing influenza season with COVID season. Below is a list of awards given by the government of the United States of America to these jurisdictions, each state, the epidemiology and laboratory capacity for prevention and control of emerging infectious diseases. And what you'll see is the recipients, listed states and territories. Then you'll see the budget period 2 base funding, what they would have before COVID-19. And then you'll see in the next list, you'll see total COVID-19 funding. And that does include periods 1 and 2, I believe. Total COVID-19 funding was issued between April 2020 and January 2021, issued in budget periods 1 and 2. Okay, so to be fair, the second column is just the second budget period, but the third column is the total budget with an increase in how much they've received. And if we go down here, we can see that these epidemiologists went from receiving $250 million total throughout the states to the epidemiology departments throughout the states have upwards of $30 billion now to divide up. You say, Thomas, why does this matter? I say the reason why it matters so assuredly is because Flu-View is very important for tracking influenza activity and always has been. One thing that they use for Flu-View is it's several different systems that they have put together in order to keep a up-to-the-week tracker of influenza-like illness in the United States. This week, 1.0% of patients visit healthcare providers were for influenza-like illness, remaining stable. Compared to week 6, 1.1 national influenza-like activities remains below the national baseline of 2.6. Influenza-like surveillance may be impacted by the COVID-19 pandemic and should be interpreted with caution. So roger that, interpret it with caution. One thing that I would interpret with caution is the fact that the epidemiology departments have decided that they will no longer, even though they're receiving an increase in funding, they will no longer be issuing information geographically related to influenza. And it seems like they've bought them out. No longer will there be the geographical spread of influenza as assessed by state and territorial epidemiologists. And it says, the geographic spread of influenza as reported by state and territorial epidemiologists indicates geographic spread of influenza virus, but does not measure the severity of the influenza activity. Due to the impact of COVID-19 on influenza-like illness surveillance and the fact that the state and territorial epidemiology reports relies heavily on influenza-like activity, it doesn't make sense. Reporting for this system will be suspended for the 2020-2021 influenza season. Data from previous seasons is available for Flu-View Interactive. Flu-View Interactive is this bad boy right here. You can see that this is the season 2021, and you can play it, and you can see that all we have is green. Green, 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 green. And if, let's go to maybe let's do 2018, 2019. 2018, 2019, let's play it. Okay, starting off green, okay, here's a little bit of yellow, okay, yes, people getting sick, okay, yeah, now it's getting a little bit sick, okay, roger, yeah, that's flu season, that's typical spread of respiratory viruses. You see how it's red, right now it would be red, February, March periods of 2019, red. So in that instance, that information is extremely important for epidemiology departments to report. and they will no longer be reporting that information in order to make that accurate description or depiction of that map, even though they will be receiving millions of dollars in extra funding to their departments. They'll be able to hire new staff. They'll be able to buy new equipment. I don't see why they're being paid so much money to do less work. I'm not a conspiracy-minded person. I am somebody that, follow the money. The simple answer is probably the answer. And the simple answer is that you can hit somebody over the head with a lead pipe, but it's much more effective to hit them over the head with a wad of cash. And so I think that the idea behind the epidemiology departments no longer identifying influenza A, influenza B, and their subgroups and issuing reports on those, I think that's absurd. They're getting paid tons more money. Why would the epidemiology departments not be having to report influenza A, B, coronavirus, SARS, nCoV-2, SARS, nCoV, HCoV, unless they are all similar, unless they all have similar, and that's all I keep seeing on this, is that it says that they're so similar that we're going to have to, we don't want to double report, so we're only going to report to COVID. We don't want to double report, so we'll only, every single system that they've used to detect influenza, see right here, for FluServe-net, they're going to be continuing to report. The only thing that they're stopping reporting on 100% is the epidemiology departments. That's the only thing they've stopped reporting on. Reporting for this epidemiology system will be suspended for 2021. Then you look at their department, 64 domestic health departments in 2020 and January 2021 were awarded millions and millions of dollars to do less work. It's just so interesting. You look at the hospitalizations, they say the hospitalizations are down drastically. This is much lower than the average for this point in the season and lower than the rate for any season since routine data collection began in 2005. I'm going to include the, this is the last one. This is one thing this is the bait and switch right here. The National Center for Health Statistics, mortality surveillance, they will continue to report this. But based on the NCHS mortality surveillance data available on February 25th, 2021, 19.3% of the deaths that occurred during the week ending February 20, 2021 were due to pneumonia, influenza, and COVID-19. They give it the acronym PIC, pneumonia, influenza, COVID. This percentage is above the epidemic threshold of 7.2% for week 7. Among the 3,972 pneumonia, influenza, COVID deaths reported for this week, 3,130 had COVID-19 listed as the underlying or contributing cause of death on the death certificate, and 4 listed influenza, indicating that the current increase in pneumonia, influenza, COVID mortality is due primarily to COVID-19 and not influenza. Any logical person can read this paragraph and take into consideration that diagnosis of COVID-19 is not based upon testing. It's based purely upon the doctor's word, and this is out of the ICD-10 code book. It's purely based upon the doctor's word. There needs to be science behind this pandemic. They have taken the facts and twisted them. They have taken the facts such as pneumonia, influenza, and COVID-19. That's influenza. If they're saying influenza is above the epidemic threshold, pneumonia, influenza, COVID-19 above the epidemic threshold. Why is it? And then they say everywhere on here that the flu threshold or the flu season is very low, low. And then at the very bottom, the bait and switch is PIC. When you see PIC in the future, that will be pneumonia, influenza, COVID. It used to be ILI, influenza-like illnesses, ILI. Now it's COVID-like illnesses, CLI. They're trading Flu-View for Cov-View. They're trading their their scientific morality for millions and millions of dollars. Millions, billions of extra dollars in funding that have been printed by the Federal Reserve that are being spent now, and that will have no value in the future. They're spending the value of the money now, and it will not have value in the future. They're taking the riches of our country, taking our health and taking our freedom, taking our liberty, taking our courage. But they can only take what we let them take.